Hey everyone, welcome to RIVE, Reflections in Veterinary Education. We are here this week and we're doing a topic discussion that Dr. Erik Hoffmeister is going to be leading. So here as always is me, Bobby Connor, and also Dr. Catherine Fogelberg. And yeah, looking forward to this week because Catherine and I don't know yet what we're going to talk about.
Yeah, thanks. I am fully hijacking this episode. This is a topic that nobody is talking about in veterinary education. It is not relevant or topical at all, as far as I can tell. So I'm going to just show you a video clip to start with.
You're going multimedia here.
Oh, fancy.
Okay.
Well, I remember this great thing an improv teacher told me back in an early improv class of like, what does all this practice and rehearsal do? What does all this improv training do? Someone's like, can you really teach someone to be funny? Can you really teach someone how to be funny and how to have a good thing? And I remember the teacher saying some version or something to the effect of, look, everyone's gonna have that night where they're on fire. Yeah. Everyone's gonna have that night where lightning strikes. The teacher was like, what I'm here to do is over time prevent you. I'm not here to raise your top. I'm here to lift up the bottom. I'm here to have it be that you've done this so consistently that your worst shows where you're tired, uninspired, grouchy, not into it, your worst show is pretty good.
Love that.
Yeah. I've heard you mention this before, Erik, the raising the bottom rather than raising the peak. Yeah.
So just like initial reaction to that, Catherine and Bobby.
I love it. I think I agree with you. I'm, there's studies out there that are conflicting in terms of should we work on helping people improve on their weaknesses, or should we help them be better about their strengths, right? So which one is more valuable and what's the best return on the investment? And I think this is a better question to ask. It's not, are you improving people's weaknesses or improving their strengths? It is, how do we overall elevate those folks who are sort of at that lower level and get it to a point where it's so automatic, then they're capable of doing it under any circumstance. And then from there, they can continue to get better thoughtfully. So I really like it.
Nice. Okay. Well, my first thought when I started was like, ooh, improv. Yeah. I was in an improv troupe when I was in college. We were called Pseudo. It was one of those things I fell into, and it was awesome. And like, it's actually, so I thought that's where it was maybe going to go. I was like, oh, we're going to talk about like how improv skills can be really useful. And so I was like waiting for that. I was like, oh, I see where it's going now. Okay. Which is arguably maybe more relevant to what we should be talking about. But I did get, that was my first impression. But then my second one piggybacks a little bit onto what you said, Catherine, is, so I don't know if it's about weaknesses or strengths, but that getting to the point where you've practiced so much that things become automated, in which case you're offloading like what you're having to use in your working memory, right? And so if we can get people to raise the floor so that you've automated so many of these things, these become just so natural that even when you have fatigue, when you have what distractions, you have anxiety, stress. I mean, that's what experts do, right? Like they have so much of what they do is automated. And so I think that's part of it. But also I think it's a mindset aspect, right? Like, because what's comfortable? Working and improving our strengths and showing off how awesome we are at these things, or, reflecting and being like, okay, what are the things I'm not good at? And again, I think the point, potentially in this, or the argument is that actually more valuable, right? To work on your weaknesses, but it's not as comfortable.
Yeah.
I think it's great. I don't know if I agree. Probably nobody's talking about it, but I think it's super relevant.
Yeah. So 2 quick things. First of all, the idea of improv actually does have some bearing on this. We might want to explore that later because I've done some improv training in relation to medical training. And number two, the other topic that came to my mind when you were talking about this, Bobby, is that's what experts do, right? But there are actually different levels of experts. And I would say that those people who are automatic and able to do it that way are probably at that lower level of expertise, which has been called artisanal experts. And then there's the virtuosic experts who take what they know really well and they kind of explode it in a different way. So just two thoughts to maybe consider for.
Yeah, I guess, what I was thinking about from a the expertise standpoint is like when you can automate things, you can take more things on, right? Like I don't have to dedicate a lot of my working memory to this part of a procedure. And so I have enough left over that I can be creative or I can analyze while I'm doing it. But I think so. Yeah, very interesting. So Erik, tell us what your thoughts are on like why you brought this.
Yeah. So I definitely want to get back to the strengths-based coaching is kind of how I conceptualize what you guys are talking about, because I did some of that work in my sport pedagogy degree. So when I saw this video segment, I think I was cooking dinner and I like stopped and I like paused the video. I'm like, oh my God, this is what I'm trying to do. Like, this is what I have been thinking about for 20 years, but I've never heard or thought of articulated in this way, right? Like all the medical error and the patient safety stuff that, I'm really excited about, and like how I focus on the students on like, I just get the basics, like I do not care if it's Mobitz type 1 or 2. Like it doesn't bloody matter because I've had general practitioners with 10 years of experience working in an academic practice call me. They're like, my dog's having an arrhythmia. I walk in, I'm like, it's second degree AV block, the blood pressure is fine, and I walk out. And I'm like, if experienced clinicians can't identify a second degree AV block, I don't care if it's type 1 or type 2,
Right.
And it like gets at the teach less better principle, which, so it was just like, oh my God, it just wraps up everything so perfectly.
Oh, I love that. That's really, I agree with you, Erik. I have never thought of it. And certainly like when you hear it articulated that way, you're like, but I'm the same way. And so I had this realization when I was a student, and I remember thinking, we shouldn't be taught by specialists, right? Like certainly not in their own specialty.
No kidding.
And because they want to teach you about the difference between Mobitz type 1 and 2 and Wenckebach and all this stuff. And you're like, I learned in vet school what Eisenmenger syndrome was.
Oh, I know. Yeah.
Because the cardiologist thought it was really cool. And it is pretty cool. Like, don't get me wrong, but what a waste of time for me to learn that. Like I still remember what it is. Like it was drilled into me for some strange reason.
So I think it's because surprising or interesting facts are more like they're stickier.
Yeah. But here's the other thing. Like you can make mundane everyday things interesting and relevant, like I think you can. I don't know, maybe if you're just like really loud and high energy, that helps too. At least that seems to help me some. But like I love, one of my favorite things to talk about in rounds is, hey, let's talk about temperature. Like, and what it tells us and what it doesn't. And, and then we start talking about fever versus like just plain, exertional hyperthermia or environmental hyperthermia. And then I love getting back to physics and I'll be like, okay, put your hand on this wooden surface and put your hand on the metal surface, and which one's colder? And invariably they're all like, the metal's colder. I'm like, no, they're the same temperature, and they're just like, what are you talking about? And they learned it at some point, but, and so then we talk about the different ways that heat moves around. And it's like this basic stuff, if you understand this, and then we talk about a fever. When you have a fever, do you feel hot or you feel cold? And they're like, well, do you feel cold? I'm like, why? You have a fever. Does that make sense? And they're like, well, what? No. Why are you asking me these questions, And I'm like, yeah. And they're like, they want to know about, but how do we treat, hypernatremia? And I'm like, here's what you do. You go, you know what? I remember something about hypernatremia. And that you're supposed to do something different. And you remember that. And then you call and ask for help.
Or go open a book.
Yeah, literally, I was telling students that today because they were asking all these questions. And I love that they're curious, right? I love that. And so we talk about it. I'm like, but you're not going to remember this because it's going to be 6 years before you have to use it. So here's what I want you to remember. I want you to remember, man, if that sodium's crazy high, I'm not supposed to do the things I normally do. And I should look this up or seek help, And because you're right. Like, so yeah.
I had a really interesting conversation today. Bobby, you were actually part of it, even though you weren't there. And the conversation started with Terry Swecker, who is our VTH administrator. He's the one who manages all the hospital things, sending me an email saying, do you know any, he said, so I remember a few years ago, we had a guest speaker here who was talking to us about why we should teach not SOAPs, but we should teach it APSO, right? So instead of doing the subjective objective assessment plan, we should teach it as assessment plan, subjective objective. And this individual said, because what happens is for learners, it forces them to make a decision and then justify that decision. Whereas going the other way around, they don't have to do that. So he was asking me, well, do you know anything about this? Do you have any literature to support this? This is what I could find. So there's actually no literature to support that in any way, shape, or form. All of the literature talks about, well, APSO is better for EHR and EMR because that way, you know, you get the information that you really want right up front. So this is like this bottom line up front situation. So we're interested in potentially piloting a study that determines whether or not the learning that occurs with APSO versus SOAP is really there, and then potentially publishing it and maybe using that to do some change within the hospital tech, which I think is really cool. But this led to this conversation of forcing students to make a decision is really important because like even, and I said, even in the military, the thing that we're taught is when you have to make a decision, the worst decision is to not make a decision. Because if you make a bad decision, you can learn from it and or potentially fix it. And if you make a good decision, great. But if you make no decision, you have no control over anything. And I said, well, if you do this APSO, it sounds to me in my head like it makes sense because you get them to commit and then they can go through all this sort of winding, why do you have to do this? Why do you have to do that? Figuring out the process. And I said, but part of the problem that I'm seeing is that our faculty, and this is not true at Virginia Tech as far as I know, but at other institutions I worked at, are literally putting so much information on their slides when they go into class that they're proud of themselves for putting stars next to the important information. And I'm like, so first of all, that's what you did in kindergarten because you didn't know what, like you weren't cognitively functional enough to be able to figure out what you needed to know. That's not what you should be doing in vet school. The fact that you have to do that in vet school means that you're giving them too much damn information, right? You need to figure out what they need to know and give them what they need to know.
Yeah, because if you can't figure out what they should know, how the heck do you expect them to sort it out? Oh, well,
they can't, right? Like content experts, we're bad at that.
You're terrible at that. I'm sorry, but like,
no, it's true.
As a generalist, I can tell you what you need to know. You don't need to know whatever you all were talking about, those fancy things. You need to know that it's a second degree AV heart block. And I could have diagnosed that when I came out.
Yeah.
Because that's
I just reviewed an article today for a general audience veterinary kind of publication, and it was like very technical about local anesthetics and like, you know, the PKA and the binding and ion trapping. And I wrote back with the reviewer, I'm like, this isn't what GPs need. You know, they need to know, like, how do you make a lidocaine CRI in a 2-liter bag or in a 1-liter bag? You know, like that's what they need.
Right. Yeah. And that's a struggle. Even so, I'm reviewing some proposals for the Morris Animal Foundation. They're supposed to write the scientific sort of description, and then they're supposed to write the lay people.
The lay persons,
And I'm like, yeah, no, right?
You should probably have given this to a lay person to read.
I feel pretty confident that this is not a lay person's. Like, they would not read this and be like, oh, I know exactly what you're talking about. You know, this is the big joke, right? You learn for 4 years how to talk like a doctor, and then you have to go figure out how to talk like a normal human being. And my thing is, I don't go into an exam room and tell people, you know, you have a Dirofilaria immitis infection in your dog. And, you know, there's an L5 stage that we can, you know, target with this, but it's the L1s like that. I say that a mosquito gave your dog heartworms, and this is what we're going to do.
Yeah. So I agree. And I take that even a step further, Catherine, when I'm talking to the students and they're like, you know, they can't, you know, how we've all heard this, and I've been guilty of saying this, use your doctor words. I do not do that anymore. Now I'm like, elbow is fine. Like if there's a word that we all use and we understand what it means, like if nosebleed is sufficient for all of us, why do we need to say epistaxis? Like what now, and I acknowledge there are some medical terms that there isn't a lay person's version, right? And so when we're talking to each other, we can use that. But if there is a common word that we all already know, why did we have to create a new one? Like why? And why would we then tell people, like, did do I not know what you mean when you say nosebleed? Like, yes, I know. So they're always like, and I'm like, no, nosebleed's fine. It's cool. It's totally
I think
fine.
that's a symptom to what Eric's saying too, is right. Like there's this, and maybe it's that, I don't know, exceptionalism, or this idea that it makes you
Yes.
appear to be smarter or be better than someone, and to be able to talk like that. And I mean,
or
I
the
don't know.
exceptionalism that so the Mobitz type 1 thing. So I teach cardiology because we didn't have a cardiologist for a couple of years. And, you know, one of the students, I was talking about arrhythmias, one of the students asked me that in class. And I'm like, I don't think that's relevant. And I moved on. And they were not satisfied with that.
Yeah.
Like, I think in their annual event, like in the course evaluation, they were like, I asked an important question that I didn't get an answer to. And, you know, I think it's part of the problem that we have with, I don't know that it's our selection, but our whole education system, right? Like we're training students to get A's, and a lot of A's are acquired by knowing esoterica, right? Answering those multiple choice questions that distinguish the A students from the B and C students, which are often esoterica. And then they get to vet school and they're like, oh, more esoteric equals good.
And then they get to their board exams and they do really well.
I guess it's that. But you know what, though, we fall into the same trap, and it's not like just the students that are clamoring for that. They're being taught that over and over again. So here's another one of my pet peeves when it comes to like this, you know, exceptionalism, whatever people are striving for. I need to feel smart, is when the term bronchovesicular. Oh man, this one I was like, so here's a term that doesn't mean what you think it means, right? Because anytime I hear somebody use it or I see them write it, I'm like, so what is a bronchovesicle? And they're like, and what do you mean? And I'm like, so you're talking about the teeny little airway that goes into the alveolus, okay? And so when you put your stethoscope up, do you think you're hearing air molecules moving? No, they have to start moving really slow so that they can actually dissolve across the membrane. And so you're not hearing that. So you aren't hearing bronchovesicular sound. So what you've now done, you've taken a scenario and but you're using a word that is a misnomer. It doesn't mean what you think it means. It's harder to spell, harder to say. Some people don't know what you mean. You're making like, why are we doing this? Because we need to feel smarter than other people. Can you just call it lung sounds, please? From now on, it's 4 letters. Everyone can pronounce it. Your clients already know what it means. Like, stop.
But you know what? This happens in education all the time too. Right?
Yeah.
So one of the things, as this textbook thing has been really interesting, because I've had so many people, great people, write these chapters. And they use these terms like didactic, and they think it makes them sound smart and like they know about education. And I'm like, you do understand that the true definition of didactic is to instruct. And they're like, oh, and I'm like, so you're using didactic to talk about lecture-based classroom.
Right.
So we're just going to say lecture-based classroom or lecture-based event instead of didactic, because you're using it wrong. And it doesn't make you sound any smarter, particularly when somebody who knows that that's incorrect.
I've been guilty of that one, not gonna lie.
But we all have. And I certainly have used it for a long time. And then I was like, you know, I'm gonna actually look this up because I don't know if I'm using this right. And I was like, oh crap, I've been using this wrong for, you know, however long I've been using it. So
I love it.
This is an adjacent concept, I think. Chris Hadfield is a Canadian astronaut, and he wrote a book, and he talked about the concept of, you basically have 3 types of people on a team. You have -1s who are getting in the way and making things harder. You have 0s who just show up and do their job. And you have +1s who are like the standout exceptional. The vast majority of people that aim for +1 end up at -1.
Oh yeah, agreed.
Aim for 0.
Yep.
And I think of it with my students, like quietly competent. Like that's what I want for my students. Just like showing up, doing the basics. Maybe you don't know all the esoteric answers, but you keep your patient happily anesthetized and comfortable and stable. You know, like
I love
that's
that.
what I want.
I just can't do the quiet part.
Yeah. I mean,
can I be loudly competent?
Yeah. I mean, I was a solid B student, practiced for 13 years, didn't kill anything I wasn't supposed to kill, never got sued. I mean, I had a couple people threatened, but they never, because I practiced solid medicine. It was good medicine. It was defensible medicine, and it kept me out of trouble. And I think that is really what every veterinarian who goes into general practice should shoot for. If you're going into specialty practice, the bar should be a little bit higher. I understand that, and I agree.
It's higher for that portion, though.
For that portion,
Yeah.
But you know, yeah, I 100% agree with that, Eric. And I think it's one of the reasons that, I mean, this is a whole nother conversation, but veterinary education needs to rethink itself, right? It needs to get its head out of its rear end and realize that we need to train competent general practitioners.
Yes.
And one of the big pushbacks I get from people is like, well, you're telling me we need to get rid of the VTH. Well, how are we going to train our next, you know, blah, 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 our next generation of specialists? I'm like, so first of all, I'm not telling you to get rid of the VTH. I'm just saying it needs to be used a little bit differently. And second of all, actually, in my model, in my mind, you're going to have more opportunity to train those specialists in a way that's truly meaningful. But the fact of the matter is that 80% of the 80% of students who go through vet school are going into general practice, and we're spending 70% of their time on specialty practice training instead of 80% of time on general practice training, which is where they're going to make their money.
Yep.
Yeah.
Agreed. And it's so I am a specialist and I love the nerdy things. Like, I mean, so I've been like dreaming this week about like having a course for the students, a semester long course that's just fluid therapy. Like that is
That's
like,
so
oh, it'd be amazing, right? Like that's not going to happen, right?
Important, but
yes, but like, I mean, I would love that. I would love it. It would be amazing, right? For me, but so I can nerd out, like you start like asking me about coagulation, like, but I know, like, I also like, I can separate that out and be like, but not every student. Now I do think they need to know more about fluid therapy because a lot of mistakes.
For sure, yeah.
But it is hard to figure out exactly what do they need to become, you know, an excellent, you know, maybe not even
not excellent.
Competent. I know.
Just
but competent.
Basic.
But I would say competent is excellent, right? Like how is that?
I think if you're graduating, competent is excellent.
No,
the excellent changes.
I definitely
You're like, no.
agree with that. No,
Yeah.
Again, it's the like thinking about the highs and lows, right? Like I don't really care how high their highs are as long as their troughs are above a certain point.
Yeah,
and
right.
To me, that's, I don't know, I guess it depends on how you want to define excellence. But in my opinion, like I think of excellence as like the peaks.
Right. But I think what I'm thinking of, relatively speaking, if we raise everybody's floor up to here, like that is excellent. Like right now, if our bottom is down, some of our students are down here and we're peaks and valleys. If I raise that floor, what we currently consider excellent could become the competent, right?
Yeah.
Like that's kind of how I guess I was thinking.
I
I see what you're saying though. Like if you raise the floor, excellent is now up here, but I'm like, what we're saying is excellent. Like we can just say, let's get rid of the fluff, right? All the stuff that they don't need to know, and they can be excellent at this stuff, right? Rather than being mediocre at, you know, all these other things they don't need to know. Like, no, let's raise that floor, but also like cut off some of the crud.
Oh yeah. Got to cut off crud.
Yeah. And I think, you know, one of the things that, so we had a little bit of a heated conversation today yesterday at the CVEC meeting, because we were talking the NAVLE and the release of scores and all the things that are associated with that. That's a whole other conversation. But I constantly go back to this idea of, it is the bottom quartile of our students who consistently have the highest risk of failure on the NAVLE. The fact that we have to measure ourselves by a single high stakes exam is a whole nother conversation, but we do, right? That's the system that we work.
That's the reality.
And so this idea that Eric brought up of raising the floor, if we can raise that floor, then we're also then raising the people.
Yeah.
Right. Because ideally, if we can bring that bottom quartile of folks up to a place where they're zeros, right? They're zeros.
Yeah.
Then haven't we effectively raised that floor from here to here in a way that's really positive? And so, I mean, I think that's a really good way of doing it. It's not trying to reach down and teach the people in the basement. It's trying to bring them up to that first floor and have them sort of feel like they're in a place where they're capable, right? Because I mean, statistically speaking, every student who comes through our program that's selected has met the minimal requirements and should be capable of completing the program. And there was actually a paper, I cannot remember who wrote it or when, I think it was probably 20 years ago, that was published that talked about going through medical school is not about your intellect. They said, in fact, anybody who has graduated an accredited undergraduate degree program with any degree with a minimum of a C average in the United States, a 2.0 average, is intellectually capable of making it through a medical program.
I believe that.
Not the intellect that determines whether or not you're successful. It's all of those other, quote unquote, what used to be called soft skills, all of those other skills that determine that. And I think that for our bottom quartile of students, it's not that they're not intellectually capable, which I think a lot of people think. It is that they don't either have the right support systems in place, they don't have the right study habits, they don't have the right places to go eat or get their hair done or churches to worship in or all of those things. It has nothing to do with their intellect. And I think that's part of the issue too. And if we can raise the floor there and help people understand that, I really think it would make a huge difference for everybody.
So Erik, I want to play devil's advocate.
Yeah, awesome.
Yeah. So I want to see. So what about when somebody says, hey, if all you're trying to do is raise the floor, what about the students that are up here? Why are we not providing, it's that age old, like, you're only helping the students that need help and the honor students aren't getting the support that they need, or you're helping the honor students and the basement students, but you're not helping that majority in the middle. So what's your response to that?
Yeah, I think it's a good question. I think my response to that is a couple of things. One, that those students who can excel and want to excel will, right? Like without me. And so that's one thought. The other thought is a lot of those students that are trying to excel are going to hit -1, right? They're trying for +1 and they're going to hit -1. I see this not super commonly here, but other places where you get those gunner students and it's like, okay, it's cool that you know about coronary steal phenomenon. What are you going to do when the heart rate and blood pressure are low, right? Like, I need you to get that basic before you go on to this super advanced concept. So I think that students are not good at determining that for themselves. So that's another thought. And then, I don't know. I guess personally, I'm kind of okay losing those middle and top people. Like, again, thinking about it from a patient safety culture perspective, if we can just not have students leave pop-off valves closed, I'll take the students not being brilliant geniuses to avoid a closed pop-off valve. I'll take that bet every day.
Oh.
I have a devil's advocate for your devil's advocate, Bobby.
Ooh, okay.
So my question to you is, what is your image of raising the floor? Because to me, there are two different ways of raising the floor, right? So you can raise the floor that raises the entire building, or you can raise the floor that decreases the space between the floor and the ceiling. Yeah. So which one of those do you imagine? Because I feel like one of those doesn't leave out the top and the middle performers, and one of them potentially does.
Yeah. Oh, and to be clear, I wasn't saying that was going to happen. I was just trying to be you can imagine, somebody would be like, wait a minute. So, I think that's a really good point. I think it would depend on how you would go about it, right? Like what your strategy for raising the floor and like, what does that even mean? It also, I think the flaw in my argument, my hypothetical argument here is that you're assuming that these quote unquote high achieving students already know all this stuff, right? Which I think is not a fair. I don't think that's an assumption that we can make, because we have high achieving students, and I can ask them these same questions that I ask everybody, and they're just like, I don't know. No one's ever asked me that before. So I do think that like what you're talking about, Erik, is saying, look, I need you to be solid with the basics. I need you to be solid with these things. I think they all benefit from, and so I do think that it's probably going to be a little bit, like this, it's going to be somewhere in between. And I think I tend to agree with you, Erik, that like, if you have a student that is like, oh, I have all this down, and we're working on this, that guess what? That's just freed up a bunch of your time that you can spend doing whatever you want to. And there will always be opportunities for there's always going to be somebody who wants to talk to them about some, esoteric, who knows what, like they go on and do an extra program. Like, yeah, feel free. That's totally great. You don't have to study a bunch because you already have this down. You've just been freed up, to do X, Y, and Z. So, but I do think it's a little bit misleading to assume that our highest achieving students wouldn't also benefit from that focus on the foundations that I think gets skipped over a lot of the time. And some people are just better at working around it than others. But I think we all benefit from getting back to the basics.
I agree 100%. And I think of that as sort of this always coming back to the educational perspective, is that whole idea of universal design for learning, right?
Yeah.
Because really what's good for somebody who has a disability is really good for everybody. And
Yep.
that's why we have elevators in every building, and every person now uses the elevator, even though it was technically only supposed to be for people who couldn't get themselves up a stair. Well,
Oh yeah. The other example of,
yeah. So
the other example of that I love is, you know, those like OXO grip, like kitchen tools. I didn't know that those were originally developed, like somebody whose spouse like I can't remember what the disease was, but they were having a hard time gripping things, but they love to cook. And so it was like all these like metal instruments are really hard to hold and handle. And like, that's all you see now.
Yeah.
That's all I have. And
Well,
those were developed with like ADA, you know, things in mind. And I'm like, well, so that was just like one of those examples that like is so ubiquitous now that we sort of take it for granted. But there's still a lot of pushback with that. So I have tried at multiple institutions for simple thing, right? Okay, this is a 1 hour exam. Every student in my class gets 2 hours for this exam, whether we have accommodations or not. And then, yes, but they're like, so, well, I have some students that now they get 4 times. That's an 8 hour exam. I'm like, no, it's not. I'm not taking anything away from them. I'm just saying whether they have gone out to seek this accommodation or not, I'm saying this is a 1 hour exam. Everyone has 2 hours, and people they struggle to wrap their brains around this.
Yeah.
And it's just because then I get in trouble because we don't have the staff to do an 8 hour exam. I was like that. And, you know, so I talked to certain people in like the, you know, compliance offices for accommodations, and they're like, yeah, that's awesome. That's what we want everybody to do.
Oh, really? That's
people
cool.
are like, you can't, it depends though. It's some institutions, some people get it and others don't. And so it becomes a challenge when you want to try to do this. And everybody's like, all right, well, I get this. And they're just used to, I get double time. Like, no, you get double the amount of time that the instructor thought, you know, an average student would need. And I'm just saying, let's not make that a hard thing. Everybody has that time, because if my rationale, the way I explain it is, if this is an exam, right, it's already artificial. If giving you extra time would allow you to demonstrate to me that you know this material, then I want you to have that time, because that's this, you know, when we get onto clinics, I can't double the time that it will take you to do, you know, whatever. But for right now, this artificial setting, I want everybody. So whether you have identified that you need that extra time or not, I want you to have it. I don't want some artificial, you know, constrictor or, you know, like barrier to prevent you from being able to tell me what you know. But man, people struggle with that.
So I agree with you 100%. And so basically I am the course coordinator for an elective course in zoo medicine this semester.
Fun.
And their grading is 60% off of quizzes. They have 6 quizzes that are 10% of or 10 points each. They have 3 discussion boards that are worth 5% of their grade, so 15 points each, and then they have a final exam. And because we're at a pass fail institution, that if as long as you have 64% or higher, you pass, those folks who go into the final with 70 or 75%, they can take the exam or they cannot take the exam. It's really just formative for them at that point. So these quizzes, right? They're between 5 and 8 questions each. And I have given everybody 60 minutes to take these quizzes.
Boom.
60 minutes, right? Didn't tell them that if, you know, but I did send out an email and I said, I have given everybody 60 minutes for these quizzes. If you are an accommodated student that requires additional time, if you would like to use that accommodation, please let me know. And I have not had a single student ask me for that.
That's an interesting way around it. Like, just give them like plenty of time, and then they go, yeah, I can do that in that time.
Right. And in fact, I do have one accommodated student who gets extra time. And this student took the quiz and spent 21 minutes taking it.
Yeah.
Right. So seems like it's working.
Yeah, that's awesome. That's actually a really good idea. Yeah.
Really interesting.
Yeah.
So I want to get back to the what I consider the strengths-based coaching that you brought up at the beginning, Catherine, which is, you know, like, should we be focusing on what people are good at and trying to elevate that, or should we be focusing on their weaknesses and bring that up? I don't know that I have a clear answer to that. I know from my own experience, at least right now, educationally, I am like, all right, the students don't particularly like me in the classroom, but I get awesome reviews on clinics. So I'm just going to steer into that, right? I'm like, all right, I've done this for 20 years. I'm not going to be Bobby Connor, right? That is just extroverted and happy and, you know, everybody loves, at least in the classroom. I am on clinics. I don't know why that difference exists. Like, everyone's like, oh my gosh, he's so approachable and he's great and all this kind of stuff. when I'm in front of 8 people versus 130. I don't know, something changes. But
Oh, that's fair.
so I'm kind of trying to steer to that and be like, all right, I've tried this for 20 years and it's not good. But I think that probably when I started off lecturing, I had not good lecture skills, right? So I think that I probably like brought them up to a certain point, and then I'm like, okay, like it's personality wise, like I'm at the top of the curve for who I am, and so maybe I'll just steer now into clinical teaching more. Anyways, that's the thought that I had when you kind of brought up like where should we be focusing our efforts?
Yeah, I mean, I think there are some things that are weaknesses that probably need some help, right? Like so for me, I really can't palpate anything worth a damn. I just can't, right? Like people are like, oh, I can feel the liver, I can feel the kidney. I'm like, good for you. I can't feel anything but a belly. This is awesome, right? Like never going to be a cattle vet. It's just not going to happen. It's just not in my genes. And I mean, I guess if I'd wanted to be a cattle vet, I would have had to work on that, right? I would have had to figure that out. And I would have had to say, okay, this is going to be some of my bread and butter. I'm going to have to do palpations of 400 cows every week. I better figure this out. And I might have at some point become competent, but I sure as hell wouldn't have been happy. And I think that's what it comes down to, right? So do we spend our time working on skills that we're not very good at and we don't particularly like, thinking that somehow that's going to help us when in the meantime we're incredibly unhappy? Or do we work on those things that we're already fairly good at, or maybe even really good at, that the work is going to be much harder to incrementally improve, but make us happy? And I would argue for the side of do the thing that makes you happy, because in the end, if you're miserable, what's the point?
Yeah.
Again, there are things that you need to be good at, like you
Right.
need to be able to do a physical exam reasonably
Yep.
well. And what I cannot do in palpation, I can make up for in hearing heart murmurs. I mean, I can literally hear heart murmurs. God knows why. People have said I can't, but I can. Not a cardiologist, but I can hear heart murmurs like nobody's business. So, and then that's still, again, not something I chose to pursue as a profession, but I would err on the side of do the thing that makes you happy. Now, if it's a weakness and you want to get better at it and that makes you happy, then absolutely do that. But if it's a weakness that just makes you miserable, then.
Yeah. So I'm going to push back on your guys' statements just a little bit, because I think we have to provide the context. Like you guys have gotten to a point where you can assess whether or not this is a weakness that can be left alone.
Right.
You know what I mean? Like you've reached a point where you say, okay, for the goals that I have enough information to say, I'm doing okay without improving that. And so I'm going to go and work over here. I think where a lot of our students may have trouble is figuring out like, what are the weaknesses that we can sort of let by the wayside, and what are the weaknesses like, no, sorry, we got to raise that floor. Right. So I think the answer is probably somewhere in the middle, but I that was one of the first things I thought about when, Erik, you brought us back to, the strengths-based or weakness-based, teaching or coaching, is that at some point we also got to feel good about ourselves, right? Like if you're only focusing on your weaknesses and you never get to celebrate your strengths, then you're just going to be like, I don't know, what's the point of doing all this, right? So I do think there needs to be some balance in celebrating the strengths that we have and saying, okay, this is really cool, but also tempering that so that, I know when, like, I remember when I was studying for boards, being like, just get caught up in reading all the stuff that I was really interested in and that made sense to me. But I had to like bring myself back, like, that's not a good use of your time right now. Like you got to read up on this stuff, which maybe isn't as interesting. And so making those choices, like rewarding yourself, now and again, be like, oh, you're really smart at this. All right, now I got to go work on this other thing.
But I think, oh, sorry, go ahead.
No, that's okay. I just think it's hard to know as you're developing, always know how to make those choices.
I agree with you 100%, but I think that's where the educator's role comes in.
Yes.
Right? That's our job when we're educating people, to help them understand, listen, I know you don't like this very much, but this is an area that if you don't do this, you're not going to be successful, or you're not going to be as successful as you want to be. And I think that's one of the things when I'm advising students, particularly as they're getting ready to do rotations and think about NAVLE, I tell them, get on the NAVLE website, take some of those NAVLE practice exams, figure out where you're struggling, and then put those rotations in a place that are going to help you really sort of connect all the material and absorb cases that are going to help you, and then study those sections. And I tell them this, you are going to want to study the things you're good at.
Mhm.
That doesn't do you any good. You got to
right
see
now.
things you're not
Yep.
good at, and then
Yeah.
go back and reward yourself with those
Yeah.
areas. So I agree with you 100% on
Yeah.
that, Bobby, that students don't
Yep.
always know, but that's where our job comes in. And that's,
No.
I think, where
Yep.
Erik's idea of raising that floor comes from,
Yes.
right? Like that's
No,
our job.
and I think the students are really responsive to that. Like my classic example is drug calculations.
Yeah.
Some people are like, yep, this makes sense to me. This resonates. And there's a good chunk of our students that it freaks them out. They do not like it. But I will say, and you know, this used to not be a strength of mine. I used to do all the wrong things when it came to trying to get students to learn drug calculations. But I was like, this is so important. You have to know this. And I've gotten much better at figuring out how to approach that. And now I'm at the point where students are like, okay, I want to learn this. I know it's really important. How do I, and we work through that. And I'm like, you're never like, it's okay if you never get to the point where you love it. Like, that's fine. Here are the 3 basic things that I need you to be able to do and do safely. And it's not even that you are the only person, but if somebody comes to you and says, can you double check my math? I want you to be able to definitely do that, right? You can ask somebody else. You need to be able to do it yourself. And they're like, yeah, but I don't get pushback from them. They're like, why do I need to learn this? Like, if I say, look, here's what I do every day, they go, yeah, we get that. Yeah. So I do think with some guidance that they can help figure that out. And that we can, but I think we can help provide those parameters too. Like, you don't need to be able, like, you don't need to go over here and do any calculus. Like, that's fine. It's all algebra. Nothing beyond algebra for your day-to-day life is going to be necessary. And so we can help provide them with realistic expectations and where they can say, this is a weakness that I can live with once we've got to this basement. So,
yeah.
So
sure.
I want to figure out how to get this in the conversation of educators and students, right? Like I would love for students to be walking around and being like, my goal here is to not kill anything because I have a basic level of competence, like that they're focusing on that rather than my goal here is to learn all this esoterica that they give me.
Yeah.
So I got an email from Jesse Watson at NC State. Yes, this morning.
Doing all the name dropping today, Catherine.
Well, so here's the thing. He sent me this. He's like, well, you and Bobby know more about podcasting than I know. I don't know where you got that idea. Just because I'm on a podcast doesn't mean I know anything about it.
That probably qualifies you as knowing more than a lot of people, though.
So anyway, so he sends me this and he's like, I've been listening to this podcast and I thought this was particularly useful or pertinent given our conversation yesterday at CVEC, the one that kind of exploded about the NABLE and things like that. Right. And it was essentially 2 physicians who were talking about, was organic chemistry important or not?
Ooh.
Right?
Cool.
To becoming a doctor.
Reaction. Yeah.
To becoming a doctor. And there was one who had been an associate dean for academic affairs at a medical school. And there was one who had been a practicing physician, from what I could gather as I listened to this. And the one that was the academic dean said, I don't think it's important. Organic chemistry is not something that I ever used in my practice. It's not something I ever talked about with my clients or my patients. It's not something that I ever sat down and said, ooh, I'm really glad organic chemistry was really hard. And I learned that because that really helped me solve this case. And so the reason that it came up was because there was an organic chemistry professor at an institution. You may have heard about this. It just happened recently. I had heard about it, who had been, he's like this huge, I guess, sort of one of the most influential organic chemists in the field. He was teaching at this institution. He had traditionally had these classes of 200 students. He taught the introductory and organic chemistry class. And he had 20 of his students complain that his class was too hard and the institution fired him.
Oh.
Ooh, 10%, only 10% complained and he got fired?
Yes.
Ooh. This is not boding well for the rest of us.
He had written like 1,300 page, things. And he had basically said to them, listen, this is, and he'd gotten reviews that were like really, really hard instructor. Organic chemistry isn't my favorite thing, but boy, when I came out of it, I feel like I learned what I needed to learn to be a chemist. And that was the sticking point. They were like, but is he teaching everybody to be a chemist? No, he's teaching people to understand something. And so then it evolved in this conversation of, is organic chemistry even something we should be requiring? And I think that goes to your question, Erik, of is that part of raising the ceiling or keeping the floor lower? Or is that part of that?
I think that, yeah.
To this idea that students need to get to the right answer. They need to know the esoterica. They need to know the things that are going to make them stand out so that they can be veterinarians, right?
Yeah.
We've taught them that.
Yeah.
We've taught them through their lower, from all the way from high school through their university, undergraduate education, that's what they need to do to be successful. And so I say that because I think that the question you ask is a really important one. And I think that no matter what we do in vet schools, we're not going to be able to really fully fix it until we figure out how to help them understand in undergraduate that we aren't looking for the smartest people. We're looking for the people who want to work hard and be happy with what they do, and the fact that they get to learn all these new things all the time, right? And are interested in the processes, because it's processes that are the most important when it comes down to it. If processes weren't important, then you would have 10 people who are veterinarians, anesthesiologists, for example, who would take a heart failure dog that had to go under an emergency surgery situation, and they would all have exactly the same protocol.
Right.
That's not what happens.
Yeah.
Not what? You guys don't have a recipe book? I thought you guys just pulled up a recipe book.
I tell people, ask 10 anesthesiologists how to anesthetize a C-section and you'll get 12 different answers.
Yeah, I say the same thing.
That's right. And that's my point.
Wait, is it Tuesday or is it Thursday? What do I do now? Yeah.
And every single anesthesiologist or emergency critical care or GP or surgeon,
Anybody. Human
will be
being.
able to tell you, this is why I did this.
Yeah.
I chose these drugs for these reasons, and they will all be right.
Yep.
Yeah.
And I think that's the problem. We teach them so much. It's about getting to the one right answer. And we do that in vet school too. This is why
the students hate it.
questions.
Because I tell them, I'm like, you guys, there's not a right answer, but there are some wrong answers. And they do not like that.
No, they don't, because they're taught that there's always a right answer. And that's the
Oh yeah. So again, like in the course I teach is like the exams are short answer, essay, that type of thing. And I've been trying to get better and better at preparing them because they haven't been seeing this, right? They've been seeing multiple choices, and I conceptually they understand, right? That and a lot of them I've learned like that they get the opportunity to explain themselves, because this is a third year course, right? So it's not like this is first year. So they're like, I have enough knowledge that I want to explain my thinking. And I'm doing some lectures in another course, and part of that is they wanted me to have like a quiz, like a multiple choice quiz. And so I did, but I wrote my typical thought-provoking questions and go through. And so I just recorded a video that I shared with them. Here's my response to this. And my goal was to get these questions for you to think about them and to, question things. And for that, it has been accomplished. And I'm really happy based on the feedback and the questions I'm getting. I didn't intend for this to cause so much stress because you didn't always get the right answer because it was multiple choice. So I'm going to regrade this, but know that this accomplished what I want, which is that you're thinking about it. I had a student email me the other day saying hey, I'm enjoying the course so far. We've had 2 lectures. I'm enjoying the course so far. You're really making me think about stuff. And I'm like, yes,
that's
this is what I want. This is what I want. And again, it's taken me a long time to get to that point. But so in my course, everything I'm doing is about, what do you think? What do you think? Here's this side. Here's that side. The assignments they have, I do these spot the mistakes assignments at the end of each lecture, whereas here's a clinical scenario. Dr. Connor did this. All right, now tell me what you think Dr. Connor did wrong and what you would have done differently. Oh, cool. And then I get all of their response. Oh, I love this assignment. And they love it. The students love this assignment. They have one after each lecture. They have to do 7 throughout the whole semester out of 17. So there's some flexibility there. But even when they don't have to, they're doing it. If they don't turn it in, they're still doing it. So, they're going back through, and then I kind of read through all their answers, and then I give my response. Here's what I was thinking, and, addressed a few things that came up from them. And they're starting to see that oh, that would be okay. Yeah, that would also be okay. Oh, that's fine too. Okay, this is not okay. And so I've been trying to be really intentional with every aspect of this course to show them that it's all vague. I don't know. You don't know. In 5 years, we're all going to know everything differently, and get comfortable with it because it's not going to change. This whole course is going to be this way. And I say it with a great deal of energy and enthusiasm and charm. So,
well, so I was having an interesting conversation with my husband the other day. I don't know what prompted him to ask me this. He's like, can you help me understand why all exams aren't open book? And I said, no, I can't.
All of mine are.
I said, no, I can't. Yeah, I can't help you understand that because all of my exams were open book because my exams were not multiple choice questions. My exams were those really frustrating NAVLE questions that said, this is what happened. You had this cow that did this, and this was the diagnosis. When you're like, I know the diagnosis. And then they tell you what the diagnosis is, but they want you to go a step further. Right.
Yeah.
And so I was like, he's like, I just don't understand. Like in the real world, people talk to each other. They, you know, when they don't know something, they ask somebody who knows more, or they go to a book, or they do whatever. Shouldn't it be more important for them to understand how to look stuff up and I'm like, yes, 100% yes. I can't help you understand why we don't do it more. And I said, that is exactly why during my MPH program, when I was teaching, all of my exams were open book.
Yeah.
And students at first some of them were terrified because they were like, oh God, open book.
It's going to be so hard. Yeah.
And then some of them were like, oh man, this is going to be great because I'm just going to be able to look up all the answers. And then I would immediately say to them, maybe 10 or 20% of your questions are going to be things that you can just look up and then you can answer from your book.
Yeah.
The vast majority of them are going to be things like, this is a principle you learned about. It's on page X of your textbook. Read about it. Give me an example of when you used it, how you used it, and why it was important for you to use it. And then they're like, oh crap, what?
Yeah.
But that's what exams should be for. And so what you're doing in your class sounds like that sounds like a class I would love. And that, but we have classes of 125 students or 150 students. And so I understand why we use multiple choice exams, but they're not the way we should be.
No. The one argument I would make in favor of closed note quizzes and exams, which again, I think the argument I would make is that in and of itself is a learning opportunity, right?
Sure. Yeah.
So if you write an exam in a way that it's not just straight recall, but you want them to like think through things, I think there is something to be forcing them to like, what do I remember from this? And how do I explain this? And how do I put that back? Because I think, and there's plenty of research that supports that if you have to pull it from your own memory rather than look it up, that will build stronger long-term memory. So I think that would be my answer to John. I'd be like, this is why. And I set my course up. So there's a mixture, and I explained that to the students. I said, here's why I have these things be closed book, and here's why all these things are open, and I want you to practice these things. But I also try to be really intentional when I'm writing the questions. Again, I'm testing them on their thought process. Really, right? Like that's what my rubrics are. It's not, did you recall a fact? I couldn't care less about that because that's literally on your phone. But your thought process you can't Google, right? And so those questions are very, I've tried to kind of create that. So that's my argument for the use of closed note quizzes and exams.
But the caveat there, Bobby, is that if you write intentional questions,
right?
And multiple choice questions, no matter how well you write them, are not recall questions. They're just not. Yeah. Because they're giving you the answer. They're literally giving you the answer. You have to be able to recognize it.
Recognition questions. Yeah. But they're not analysis or application usually. No.
To kind of pull it back, I guess what I'm hearing is, the idea that there's not a right answer. There are some wrong answers. If we can get those wrong answers right, that'll bring that floor up.
Yeah.
That's a nice way of summarizing it. Actually, I really like that. just get them to stop giving us the wrong answer.
Yes.
There's plenty of right answers to choose from.
Right.
Yeah. No, but seriously.
Yeah.
I mean,
you literally have like a basket and it has like 100 balls in it, and 90 of those are right and 10 of those are wrong.
Just recognize
pull out a right answer. Quit pulling out the wrong ones.
Well, and you can pull out the wrong one and go, you know what? On reflection, I think this is a wrong one. Let's get another one, right? Actually, I think that's a really nice way of looking at it, is that of all of the answers that are available, just eliminate the wrong ones. And like that's actually pretty good.
Yeah.
Pretty good.
Sure. Yep. That's a really interesting topic, Eric.
Yeah, thanks for indulging me.
That was fun.
But I saw that and I'm like, my brain just exploded. I'm like, okay, the first chance I get, I want to talk to other people about this topic because, it's like that's my raison d'etre right there, right? I just stop leaving the pop-off valve closed. That's all I ask.
Can you use some layman's terms for what you just said?
Oh. Nice. Or spell it for us.
So.
One or the other.
I can't begin to describe that to a layperson.
Oh, that's funny. Yeah, no, I agree. This was really fun. And I have now got ideas for what I'm going to do for our next journal. I'll tell you though, I like well, I guess you're going to have to know about the journal in advance, but for now, just in case I can't find what I want, I'm not going to tell you.
I mean, if you want it to be a somewhat interesting conversation, it'd probably be a good idea to give us the article beforehand. Otherwise, it's just going to be us silently reading for a while.
What do you think they wrote about here? Actually, with what I'm thinking, that could work. Anyway, we'll save that for next time. Yeah, no, this was really fun, Erik. I loved it, and surprisingly, we had plenty to talk about.
What a shock!
Yeah. Cool. Well,
Awesome.
thanks for listening.
It's been fun. We'll catch you all next time.